So, all right, with that, let's get started. Basically, I actually put this presentation together so that people would go from a place of anxiety and fear and actually instead transition into a place of empowerment and actually creating an action plan for themselves and their family. As an emergency medicine physician, I've been practicing now for 30 years. This is my 4th pandemic. I've also worked in a natural disaster, and it's very important to actually create a plan and begin implementing a plan, and then you'll begin to see successes of actually implementing a plan. So the intention of the webinar is that all participants are informed with COVID-19 science that will help you and your family stay healthy during the pandemic. The outcome is that you'll leave the webinar motivated to create an action plan for yourself and your family, and you're motivated to create an action plan subsequently for your broader community. So I get asked this a lot: what is a pandemic? A pandemic is any worldwide spread of a new disease. It must be an infection, it must be contagious, and it must be something that people do not have immunity to. So an example is smallpox, polio, tuberculosis, bird flu, SARS, or MERS. A lot of people have asked me, why is it called COVID-19? All of these diseases actually get their name from the World Health Organization. So CO is corona, and that is Latin for crown or halo, because if you look here to the right, the virus actually on a 2D, underneath the slide, underneath the microscope, actually looks like it has a crown or a halo around it. VI is virus, D is disease, and then 19 is 2019. It is the year that the strain appeared. It is not that there were 18 before this particular one. So hence the name COVID-19. Why is all of this so important? We've all experienced pandemics before. If you're over 65, you may have actually experienced more than one. There may be people on this presentation that remember polio and tuberculosis, etc. But most people remember HIV was a pandemic. And when it first came out, it was called immunodeficiency disease of unknown origin. So the outcome of a pandemic, there's 2 possible final outcomes. One is a complete cure or near complete cure, which would be smallpox. Smallpox was eradicated from the world in 1980. Polio is near complete, but not complete. Or there's some sort of containment or management, which an example of that would be HIV. So let's talk about coronaviruses. This is basically a disease that's about people and surfaces. So the disease spreads through small droplets from your nose or mouth that are either, that an infected person either coughs or exhales, or it's on their fingers, and then it lands on a surface, and then the surface is contacted by another person who is not infected, and they then put those droplets in contact with their eyes, nose, or mouth. So I tell people it's very important to respect COVID-19. One, it's a droplet disease that stays on surfaces for a very long time. It can stay on a cardboard surface for 24 hours. A less porous surface like plastic or metal, it can stay 96 plus hours, so 4 or more days. The other thing about it is it's highly contagious. So how is contagiousness actually measured? So it's calculated by what is the minimum time of exposure that you have to actually get an infection. So for COVID-19, it's 45 seconds. Then also, what is the percent penetration? So basically, if I had 100 people who were exposed to it, how many people would actually get the disease? When you look at something like influenza, that number's down around 20 or 30. When you look at COVID-19, it's up around 60 to 80%. Now, let's talk about the difference between a droplet disease and an airborne disease. A droplet disease is large droplets that hit mucous membranes. Airborne disease are small particles that are inhaled. Droplets are less than 5 microns in diameter. Airborne is less than 5 microns. Droplets fall 3 feet or shorter from the distance of origin, and airborne remain in the air longer and can land 5 feet or more from the origin. So a droplet disease is Ebola, pertussis, or mumps, or COVID-19. An airborne disease is tuberculosis or measles. So initially, when the recommendation came out, it came out for us to stay 3 feet from each other. What we're seeing now is that there are some COVID particles that are acting more airborne, even though they are large particles that are greater than 5 microns. So if you look at what that actually looks like this is a person coughing, and it shows 3 feet versus 6 feet. So it's all of the surfaces in this span that are actually impacted. So if you imagine someone at a store or at a gas station pump, you've got all the surfaces that might be in this distance or in this area. So one of the things you have to look at is highly trafficked surfaces. Doorknobs, door handles, debit card pin pads, gas station pumps are a really, really big one. Phones. Also, if there are any hospital workers in your family, it's very important that they actually get rid of shoes and scrubs before coming into the house, because the shoes and scrubs actually can carry COVID-19 from work. Or if they actually wear a protective covering that is a complete protective covering. I see some people are wearing gowns, but then not shoe coverings, or gowns, they have a complete one that's almost like a jumpsuit. So let's talk about risk factors. These are the risk factors for having a severe illness with COVID-19. Most people have heard the elderly. Well, specifically, it's born on or before 1955. And I put that in here because a lot of people actually say, well, I'm not elderly. I still go to the gym every day, or I still exercise or work out. It is really based upon the year that you're born. So it's on or before 1955. Those who live in any sort of nursing home, long-term care facility, I would also say any sort of rehab unit. Anybody with chronic lung disease, moderate or severe asthma, heart disease with complications, bypass stents, anyone immunocompromised, which would include cancer, autoimmune disease, like diseases like lupus, rheumatoid arthritis, or HIV. Also, any disease is not particularly well controlled. Diabetes, renal failure, liver disease might also be at risk. Pregnant women in general don't do as well with viral illnesses, but the CDC has not officially listed it as a risk factor. However, I'm seeing a lot of pregnant women come into the emergency department with symptoms, and I think this is going to bear out later as actually being a risk factor as well. The one that a lot of folks are not talking about is any age. Severe obesity is also a risk factor. And obesity is measured by a BMI greater than 40. So I know there's been a lot of information about how Louisiana is having poorer outcomes than New York, and New York is having poorer outcomes than California. You will see something like obesity is going to make a difference in some of the outcomes that we're seeing. So I just want to go over just quickly, what does a body mass index over 40 look like? So if you're 5'2" over 220, 5'6" over 250, 5'10" over 280, or 6 feet over 300. So that is a BMI over 40 for a man or for a woman. Okay, so now let's look at other risk factors. 1, men. Men are more likely to get the disease, and then when they actually do get the disease, they do poorly. So when you look at the infection rate, there's about 20% more men that get it than women. And then when you actually look at the death rate, they actually have a death rate that's almost 40% higher. So 1.7% versus 2.8%. And all of the original articles for this research is on my website. So on my website, AskDrV, drv.us, all of the New England Journal of Medicine articles and all of the links are actually on the website. Okay, clinical outcomes. If you have one risk factor, you're more likely to die, need a respirator, or have to go to the ICU by 79%. If you have 2 risk factors, that increases by 250%. So 2 risk factors really makes a huge difference. This is just death rates based upon the actual healthy person versus people with different types of risk factors, and clearly cardiovascular disease is one of the ones that is the worst risk factor to have. So let's talk about prevention measures. How do I prevent getting COVID-19? How do I prevent spreading COVID-19? And then what happens if I or my family get COVID-19? So there's been a lot about hand washing, and I actually wanted to show these 3 slides because these are the 8 steps that are associated with hand washing. Most people do number 1. Some people will do number 2, where you actually wash in between the fingers. Most people never do 3 through 8. So 3 is washing the back of the hand. One of the areas that's commonly missed is number 4, the base of the thumb. Number 5, you're washing the back of your fingers. Number 6, you're washing your fingernails. Washing your hands goes all the way to your wrist, and then drying, wiping and drying. So I wanted to show that so people could actually really say, you know, okay, what do I need to, you don't just wash your hands for 20 minutes. You want to actually go through these 8 steps. Now, social distancing. There's been a lot about social distancing. Should we open back up? What states should open back up? This actually goes over the power of social distancing. With how we were operating normally, 1 person in 30 days infects 406 people. With 50% less exposure, 1 person infects 15 people. With 75% less exposure, 1 person infects 2.5 people in 30 days. So social distancing makes a dramatic difference when you actually look at this begin to actually multiply. Now, hand washing, social distancing, and what else do I need to do? So one of the main things is I would not go to the grocery store. It is really important, if you can, to order your food and your medication online. I know that one of the things that this is actually bringing out is the digital divide in America, and how there's so much in rural America and some inner city areas, and also elderly who are not online. If people are not online, it would be important that they actually get someone from their family or from their extended family to actually order food and have it delivered to them, and they could send them a check in the mail. When food comes, I tell people do not have any contact with the delivery person. Do not even do a handoff. Bring the delivery into your home, and do not put it on a counter, and do not put it on a tabletop. Instead, you want to put it on the floor, because that is, if there is anything on the packaging, you don't touch the floor commonly. So transfer any cooked food into your own Tupperware containers as soon as possible, and throw out immediately any paper, cardboard boxes, or paper bags from the delivery. Obviously, clean highly used surfaces frequently. We're also recommending that people avoid cash whenever possible. Cash is highly trafficked. It's got a lot of hands that it's going through. When you use your credit cards or debit cards, you want to make sure that you're wiping down your credit cards or debit cards afterwards. Now, the other thing that's important is sometimes people think, well, I've been over here socially distancing, and my family's been social distancing on the other side of town, and why don't our 2 groups get together? That is not recommended for any holidays, just catching up, funerals, or anything like that. One of the things that we've found is that when people actually do that, they actually create clusters where there's clusters of COVID-19 in the family, and there's a cluster of deaths in the family. So I would definitely not recommend that. Now, when you're caring for people with asthma, or if you have asthma, this is very important. You're not able to distinguish between an asthma attack and a COVID infection. A COVID infection can also cause wheezing, difficulty breathing. If you use a nebulizer at home and you have a COVID infection, you do not know it, you aerosolize it throughout the home, and it will be easier for other people to get infected. So it is important instead that you use an inhaler with a spacer or an aero chamber. Normally that contraption, which I picture here on the right-hand side, can deliver the same amount of medication as a nebulizer machine without actually aerosolizing the infection. For those who have very bad asthma and feel that they must use their nebulizer machine, I recommend that they use it outside or in the garage. In several of the hospitals that I work in, we will not use a nebulizer machine anywhere in the hospital or in the ICU. Now, there's a whole other thing around increased viral load, and that the people who are actually not doing as well with COVID-19 have actually basically come into contact with more virus particles than others. That can be from repeated contact, but that can also be from viruses that kind of accumulate. And one of the areas that they're looking at is facial hair. So there's two things about facial hair. One is if you have facial hair, your mask does not fit as well. And it may also be a site for the virus to accumulate. The CDC is not recommending this, but I am recommending this, which is get rid of facial hair until this pandemic is over. I don't think it's actually worth the risk, especially given what we're seeing with the increased incidence in men and the increased death rate in men. To wear a mask or not to wear a mask, as many of you know who've been on this call, we have been recommending wearing a mask now for the last 2 months. Now, there's some do's and don'ts about wearing a mask, and I'm just gonna put them up here quickly. It's very important that you wash your hands before touching a mask. You cover your mouth, nose, and chin. You make sure that the metal plate is at the top if you're using a typical mask. You avoid touching the mask. And then you discard it immediately after use into a closed bin. You don't want to actually have the mask be loose, and you don't want to pull the mask down while you're talking to someone. Now, a lot of people have asked me, I'm not able to get the mask that I'm seeing, the sort of surgical mask. What sort of things are best for me to actually make a mask out of, or to use as a makeshift mask? So there's two things that one study looked at for this. They looked at, the barrier and how much does it keep the virus out, and then also breathability. Can you breathe with the mask on? So the things that actually came out and were the best was denim, canvas, bed sheets, and paper towels. The thing that was worse was scarves. So any sort of wool or ramy scarves actually tested the worst. Now, women who are pregnant or near delivery, I think they should really consider a home delivery with a midwife if they actually have a normal pregnancy. There was an labor and delivery ward in London where they tested the nurses, and all of the nurses in the L&D ward tested positive for COVID. So there's so much COVID in these hospitals that I actually, I would try to stay out of them if I had a normal pregnancy. Now, I know there's a lot of people missing their personal care services. They are missing getting their hair done and getting their nails done. I would not go to anyone's house to get my hair or nails done, and I would not allow anyone to come to my house to get my hair or nails done. It's just simply not worth it. All of us are at home struggling in this area, and so it's just not worth the potential exposure. So let's talk about action plan. So what if I think I have COVID-19? What are the symptoms? So let me talk first about one. You can have no symptoms and have COVID-19. And I think that is very, very important. And you can give it to other people. One of the earliest symptoms that people actually report fairly repeatedly is loss of taste or loss of smell. As a result of loss of taste or loss of smell, you may find that they eat less or say they don't have an appetite. Then also there's GI symptoms, nausea, vomiting, diarrhea. There's also what we call hypercoagulability, which means blood clotting. So people are getting clots in their lungs and clots in their legs. Then there are the respiratory symptoms that you normally hear about, which are upper respiratory symptoms of headache, fever, achiness, kind of like a sinusitis. And then a lower respiratory symptoms, which are a dry cough, difficulty breathing, may become like a bronchitis or a pneumonia. The other thing that we're seeing in is a dermatologic symptom, which they call COVID toes. And I'm going to show you a picture of COVID toes. These are, the toes almost look like they're frostbitten, but it's not necessarily the wintertime, or they haven't been exposed to the cold. We're seeing this in all ages, but there is a stronger predominance in kids. So it's very important for parents to be able to recognize this if they see this with their kids' toes, because it's very important to know that your child most likely has COVID-19 if you see COVID toes. What to do if I think I have COVID-19? Well, the World Health Organization originally actually put out something to avoid ibuprofen and actually take Tylenol instead. They subsequently walked that advice back. I've been telling people I would stick with that because I don't know if they had industry pressure to walk that back. And I'm actually recommending for my people that they stick with Tylenol and avoid ibuprofen. It's very important, do not go to the hospital unless you're really, really, really sick. You don't want to be in a situation where you go to the hospital for a sprained ankle or something, and then you catch COVID-19 in the hospital and you only had a sprained ankle. Aggressive testing guidelines, I get a lot of questions about testing, and unfortunately it varies state by state. I work in different states myself. Ideally, we would have testing criteria that are consistent across states, but we do not. I think that we are going to have to develop some consistency, some baseline consistency, given the amount of people who are asymptomatic and actually transfer the disease. Social distancing versus self-quarantining. So social distancing is what everyone is doing. Self-quarantining is for people who are COVID-19 positive or who think they may be COVID-19 positive, or who've been tested and they're waiting for the results. So you should also self-quarantine if you're waiting for the results of a test. Social distancing is staying 6 feet away from others. Quarantining is complete isolation. So that is actually when you're in a room by yourself, preferably that room has a bathroom, or if you use a bathroom outside of the room, nobody else is using that bathroom. Family members actually bring your food, drop it down at the door, and you open up the door, have no contact with them, and bring your food in. Social distancing is what we're doing for now. Self-quarantining you do for 14 days minimum. If you have a COVID test and it comes back negative, then you can actually go back to self-distancing. What is important is if you have COVID-19 and you have symptoms, if the symptoms go away, you still have to do the 14 days. So just because the symptoms have gone away, you can still infect other people. I put preferably 21 because there were some studies that showed that some people are still positive after 14 days. And in order to get complete COVID negative testing, they found that they had to do 21 days. Now, some people have thought, well, why don't I just catch COVID-19 and get immunity? Well, that's not a that's not a good idea. So COVID sits in the lungs and it appears like ground glass by CAT scan. It causes pulmonary scarring and pulmonary fibrosis. Those people who have the viral pneumonia, there's a 50% death rate. So that's all of the people that are on ventilators and they're having problems breathing on ventilators. It's estimated that about 1/3 of the people who survive a COVID viral pneumonia will have decreased lung capacity, and they have problems with even just normal walking. In addition, it's unclear how long the immunity actually lasts. We are seeing in Wuhan, China now, people who have actually caught COVID for a second time. So it is not something where we're necessarily seeing that people have lifetime immunity after catching it. So how to win against COVID-19? One, early detection and early response. That is the most important thing in any pandemic. The other thing is what we call universal precautions. And so universal precautions is this. I assume that I have COVID-19. I assume that you have COVID-19. You assume that you have COVID-19. And you assume that I have COVID-19. And then we each act accordingly. So this is really, really important. When you assume that everyone has COVID-19 and then you just react, you carry about your day as if you and everyone around you has COVID-19. So that'll have you begin thinking, what would an action plan be for myself? Wanted to just go over a little bit about asymptomatic people spreading COVID-19 because I actually get a lot of questions about this. And I brought these 4 articles up here. The first one here to the left is Borne, Italy. It's an Italian town, very small town. They tested everyone in the town. Well, first they just tested the symptomatic people like we're doing, and they could not get rid of COVID-19. Then what they did was they had to actually test everyone against the public health experts, and they found that there was a large percentage of asymptomatic people that were testing positive. And they actually then isolated and quarantined those folks. And they had to actually do it for 21 days until they actually had everyone in their town COVID negative. Now, a lot of you have heard about the USS Theodore Roosevelt ship, the one where the captain was fired or demoted. They tested everyone on that ship, and they found 50 to 60% of the people that were COVID positive had no symptoms. Similarly, if you go down to Iceland, Iceland is the country that has tested the largest per capita number of people in the country. They found 50% coronavirus cases with no symptoms. And then lastly, Cook County Jail. So Cook County Jail is the largest jail in the country. The inmates there filed a restraining order, an emergency restraining order to get PPE and also COVID testing. They won that. It led to the testing of the entire jail. And there they also found about 50% of the people were COVID-19 positive with no symptoms. So what if you have COVID-19 already and you have somebody in your family member that's either admitted or in the ICU? So I want to go over this just a little bit about sort of what works, what doesn't work. Again, I keep all the pertinent information on the website and on Twitter and all the different places. So I want to go over what works and what doesn't work. So there's been a lot of conversation about different therapies. We are now getting early results that are being reported in the New England Journal of Medicine. So things that are showing promising results. Remdesivir is an antiviral medication. It is showing very good results. About 68% of the people that are getting it are actually getting improvement in their oxygenation status. Similarly, plasma therapy, which is people who've had COVID-19, donate their blood, you take the plasma. They're seeing similar results with plasma therapy, right around 65 to 70%. What is not showing positive results is chloroquine or hydroxychloroquine, which is the malaria drug that you've heard the president talk a lot about. A lot of those studies have actually been stopped because they actually are causing harm. So they are not improving patient care and they are causing harm. Lopinavir and ritonavir are HIV medications. They're not causing harm, but they're not really doing they don't seem to be working as well. So right now, the two things that seem to be working are remdesivir and plasma therapy. I just added this, which was on the malaria drugs, where it shows that there's no benefit and there's also a higher death rate. So it actually causes harm. We're seeing these studies actually emergently being stopped. Now, forward-thinking actions. Here are some things to think about as you begin to actually create your plan. Consider now, what if I had to be quarantined? Where would I do that in my home? How would I do that in my home? Do you have the over-the-counter medications that you need? Purchase them now. What mask or mask alternatives do I have in my house? How can I make masks? What can I make masks out of? How am I going to limit my exposure to highly trafficked surfaces? If you're a company or a union, then you need to look at what is the occupational health plan that's actually going to keep our employees safe. If you're a state or a local government, I think it's very important to engage a multidisciplinary group of community leaders, medical professionals, and elected officials to address community outreach, PPE, staffing, and healthcare access. And it's interesting, I've had this slide here for probably about 6 weeks now. Governor Woodman of Michigan actually just did exactly this, specifically to look at health disparities. The other thing is have a conversation and be clear about your family members' wishes around if they want to be put on a ventilator or resuscitated before anyone gets sick. What's next? So we're going to continue social distancing until we've turned the corner. I know there are some states that are actually looking at opening up. I think Georgia and Texas, which I think is not really the right decision. And if you live in, I would say Georgia, Texas, and maybe Florida, you've got to look at how do I actually modify my behavior if my state decides to go ahead and reopen early. If your employment is significantly impacted, you've got to look at what else you can do remotely. A vaccine is about 12 to 18 months away. They're currently already have given the vaccine in China and also in the state of Washington. So the early clinical trials have started. I suspect that by the end of the year, they will actually have something hopefully for frontline employees. And then maybe next year for the general public. I recommend people stay informed with local government alerts, the CDC, the World Health Organization. I also put on here the EPA because the EPA has a list of disinfectants that actually are antivirals and work well against COVID. I know there's been a lot of people rushing to go get Clorox. There's actually 400 listed on the EPA.gov website, and they actually tell you how well they work as far as how many minutes or seconds it takes to kill COVID-19. So I tell people respect COVID-19, create a plan for yourself and your family and your community. This is my Twitter account if anybody wants to ask me anything on there, and this is the website. So this website actually has the link to the studies that are supported by the facts that I have here. So many of them are New England Journal of Medicine articles that are linked there if you want to actually go there and actually take a look at the original sourcing for the materials in this presentation. All right, let's turn it over to some questions and answers.
Okay, thank you, Dr. V. We certainly appreciate your efforts weekly, bi-weekly, twice a week doing this, keeping us safe. We had some new information today. And I also want to encourage everyone who's listening to feel free to share the fact that we do these broadcasts every Tuesday and Thursday. And as you can see, for those of you who've joined us before, it's constant updates. So you definitely want to be a part of that. Let's go to our first question. And I'm going to go to the chat first. And the question is, the New York Times wrote about COVID pneumonia, suggesting that people use their own pulse oximeters. Do you support this practice? And I hope I said that right. Pulse oximeter.
Yes. So you're talking. Is the question at home? She's talking about at home.
I don't know. I assume, yeah, use their own. So yes, it would.
Yeah. Okay. All right. So yeah. So COVID pneumonia is the viral pneumonia, right? A lot of people don't have pulse oximeters at home. So if you have one, I would say, if you have one and you know how to use it, I would say use it, because there is a sensation of shortness of breath, and you may or may not actually be getting oxygenated enough. And if you put the pulse oximeter on, it'll actually give you the number. You know, you'll know that if you're less than, if you're less than 93, 94%, then you are really struggling to breathe. Whereas some people just get the sensation that they're struggling to breathe. But unfortunately, most people don't have a pulse oximeter at home. I don't know. A lot of people don't have one.
Okay, thank you. And I'll remind you, we're taking questions right now in the chat as well as in the Q&A, and I have several queued up, so I'm going to run through them.
Okay.
The first is, and I don't know if you are intentionally not showing your video, but right now we just see your name, just FYI.
Yeah, no, I'm actually, I'm trying to actually get it to go. I'm trying to figure out what to do. This has been a constant problem here, trying to get back off of Zoom onto my, so go ahead, I'm working with it.
Okay, no worries. Just want to make sure you were okay.
Yeah.
All right. So the first question is, when do you think it would be safe to travel on an airplane? For example, say from California to Florida. And I would probably say, do you have any advice if you have to travel?
Right. So, okay, can you see me now? Oh,
Not yet.
there we go.
Yeah.
We go. All right. Okay, so it's so funny that you actually asked this question, because I was asked this today on Twitter. And I am, so I have a cousin that was a flight attendant and had COVID symptoms for nausea, vomiting, and diarrhea. She also had some of the dermatologic symptoms. And she could not get COVID tested. And I told her to go ahead and quarantine for 14 days. After the 14 days, her job wanted her to go back to work without a mask. So I say all that to say, so I actually wrote today, I said, until they actually say how they're regularly testing their employees, how they're cleaning the planes, how they're cleaning the air, and what number of their employees are COVID positive, I am not flying.
Okay. Next question. Should families practice social distancing in the house as much as possible? That is, trying to stay 6 feet apart, sleeping in different rooms.
Yeah, so I would say, we haven't necessarily, so it depends. So let me just say this. If I had someone that was a high risk factor, they either were, had asthma or cardiovascular disease or any of the risk factors that I listed, then I would say that you probably would need to social distance. For those that are in the same family and no one is at high risk, I would say you're probably okay just acting normally within the home.
Next question. Can you share some tips for how to sanitize if I either 1, live alone, or 2, live in a shared house, or 3, in an immunocompromised or older home? And how often do I need to do it?
Yeah, so a couple of things on sanitizing. It's better to have a spray bottle, do you know what I mean, to spray a surface than it is to take a cloth and wipe it down. So I recommend spraying, even for things that are coming into your home like groceries, because you get a more even distribution of the disinfectant, right? And as far as how frequently, it really depends upon how much traffic that area gets and who's going in and out of the home. What I've done is we've set up a basement bathroom, and we use that for those of us that are coming in and out of work. And we simply change our clothes and shower before coming upstairs to the main house, because there's 2 of us that are in the home that work in the healthcare industry. But if you have people that are going in and out a lot, then you want to actually clean more. If you have folks that are basically, all basically inside, then you may want to actually clean less. But there's no hard or fast rule to any of this.
Okay. With 4/20 being Monday, I am curious about the effects of smoking marijuana and COVID.
Yes.
I no longer actively smoke, but have in the past. What do I need to do to stay healthy?
Yeah, so it's interesting. So they found that any smoking of anything actually puts people at higher risk of not doing well with COVID-19, particularly vaping. and we don't know exactly why vaping is coming out as such a risk factor, but I believe that it's because it seems to be making the younger people more at risk for having problems than they normally would. So I tell people I wouldn't do any smoking of any sort around this time. I wouldn't even be around smoke of any sort. The other thing, which I know, a lot of people are self-distancing and at home a lot, but the other thing that decreases your immune system is alcohol. So that's the other thing to do in moderation.
In dealing with marijuana, is there a difference? Do you have a similar advice in terms of like edibles or oils and?
Yeah, you're not going to get it. Yeah, I mean, edibles. If you're someone who uses 420, for medical purposes or recreational purposes in an area where it's legal, you'd be much better off doing edibles or oils.
Okay, thank you. Next question. I read today that the CDC says the second wave could be worse. This makes me so anxious. How can I feel safe if they open up the states and there will be a worse wave in the fall?
Yeah, so, I think it's really important and part of the reason why we're doing this webinar is for people to actually really feel empowered so that they're actually making their own decisions. I know that several of the people who've been on this webinar have already started talking with their physicians about getting notes that they have to continue to social distance because of whatever their age, whatever risk factor they have. There's been a lot of talk about COVID-19 and it getting better in the summertime. It really doesn't seem to be heat impacted. It seems to be UV light impacted. So it will, in the outside, in the summertime, not stay on surfaces quite as long. However, there's a lot of contact that people are having with this COVID-19 virus that are indoors. But that's why they're actually suggesting that in the fall, when it begins to get darker and dimmer, that there's going to be sort of like a second wave. I think that one of the things that's really, really important is that we actually get our testing and our public health surveillance in place. I know with the bill that was signed today, there was a lot of money in that bill for testing, and hopefully we'll get the testing and surveillance in place, and it will include frontline workers, asymptomatic people, so that we'll really get a sense of who has this and what is the penetration in different areas. But it is, I think it is unsafe, and it is actually, particularly in the states where they're opening up beaches and they're looking at going back to regular life.
Okay, I don't have access to open the mics, but if you could call on Deborah Thompson, or if you want to switch it to me, then I'll go to her. And in the meantime, I have some other questions from the chat.
Okay. All right, good.
I'll do that then. All right, so next up, I have a loved one in a nursing home or assisted living facility. I can't visit and I'm nervous. How can I help them?
Yes, so the best way to help someone who's in an assisted facility that you can't actually visit is to actually, you can actually either see if one of the nursing staff will FaceTime or use their phone to actually interface with them. That's probably the best thing if you can find someone that is actually willing to do that at the nursing home for you, so that you can actually be in contact with them. And outside of that, it's just calling.
All right. And Deborah K., your mic is open. Please ask your question.
Hi, my name is Deborah Thompson, and I'm from Jacksonville, Florida, from the NAACP Jacksonville branch and the State Conference for Florida. And my question has to do with the plan that you mentioned that we should work on. What should be our first step And the second question is, for those people who use those breathing machines at night, I can't remember what you call them.
The CPAP machines.
The CPAP machines. What type of risk factors are involved there?
Yeah. So the CPAP machines that are for sleep apnea, those are contained systems. So those are not actually blowing air out like the nebulizers are. So the main thing that I say for people who are using CPAP machines is that they just clean them daily like they're supposed to. So a lot of times people are not cleaning them daily. It is important to clean it daily, because again, if you have COVID-19 and you don't know it, then it is going to be inside of your machine. You use it one day, you use it the next day, you use it the next day. You're just re-exposing yourself over and over and over again. I think as far as when you look at developing an action plan, I think that, you know, whether or not it's a family or it's a community, you've got to look at, okay, now that I understand how this disease actually progresses, what are the high-risk things that I have going on? Do I have someone in my house with asthma? Do I have hospital workers in my house? Do I live in a high rise? Do I not live in a high rise? Do I have to take the bus or the metro every day to work? Or am I able to drive my own car to work? So that people can then customize their action plan to what their particular life actually looks like.
Thank you.
Okay. Hold on a second. It looks like Holly's accidentally.
Sorry, I apologize.
Okay.
Thank you, Deborah K. That's what I said. Thank you, Deborah K. And we
Okay.
are moving to the question in the Q&A box now. Follow up to the alcohol question. I did see that about alcohol. What does in moderation mean? I stopped drinking wine because I was nervous, but I would like to have some wine. And so would I, by the way. I agree with this question. And is it particular to certain types of alcohol? I mean, if vodka's better or tequila works okay, I'll go that route. No, I'm kidding.
Oh gosh. So no, I haven't seen anything. I haven't seen anything on whether or not wine is better than tequila, better than vodka. I haven't seen that. I think that when they say in moderation, I think that if somebody's having, 2 or 3 drinks once a week, you know what I mean, that would be considered in moderation. I know that there's been a lot of stuff about, people saying that they're drinking more in this environment or they're drinking every day. Certainly when you start to drink daily, that is absolutely not in moderation. So I would say, as long as it was sort of kept down to once a week, maybe twice a week at the most, I think, but we haven't really done the studies. So it is really, some of the stuff some of the stuff we have actual evidence on, and then some of the stuff we don't.
Okay, thank you very much. All right, it is about 8:54 p.m. I want to remind people that if they would like to volunteer, to please reach out to us via email or on the website. And we have time for maybe one more question if there is one available. If not, I think we are done. So let me see if there's anything else in the chat that I've missed. Thank you for the excellent presentation. Thank you very much. We do this every Tuesday and Thursday. We invite you to share this with your friends, just how you found us. We are here every Tuesday and Thursday. The information is updated consistently. So it's good, even if you've on today, you may check back in at least once a week with us to see anything that has been updated. Okay, last question here. A lot of stats are doing rapid testing. Can I trust the test if I have to self-administer? Oh, I'm sorry. A lot of states. Rapid testing. Can we trust tests that are self-administered? Thank you for that.
Yeah. So you are going to have some user error in the tests that are self-administered. So they're doing two things. They are doing tests where you don't have to go as far back into the nasopharyngeal area, and you can kind of get it a little bit more anteriorly. So that's one thing. And they're also doing this self-administered test. You always are going to have more problems with a self-administered test. However, I do think it increases the likelihood that someone can actually get the test. And in general, we have not seen yet what our false positive or false negative rates are. When I see patients clinically, if they have a negative COVID test and I still really suspect it, I repeat the test. And I do the same thing with influenza, because the influenza swab in general also has probably like a 20-25%, where you do the test, the patient really has the disease, but the test comes back negative. Mm-hmm. So that is something that we always have to worry about.
There's a comment on the accuracy of the test related to sensitivity and specificity.
Yeah, I don't have those. Right now, everybody is using a different test. so there are, so I don't know the story. So the World Health Organization sent us about 1.5 million tests in February. We said we didn't need them, that the CDC was going to actually roll out the standard test for the United States. So when the CDC actually rolled out that test, it was faulty and it did not work. So then they were scrambling and they went to LabQuest and all of these different organizations. So now you'll find some hospitals actually have their own test. LabQuest may have their own test. So when you actually look at all the tests right now, they're so different. I work in Virginia and it takes a week for the test to come back. I work in New Hampshire. It takes 2 days for the test to come back. I talked to somebody who works in Connecticut and it takes 30 minutes for the test to come back. So one test is not the same as another test. So we don't have any sort of aggregate data. And I think that what's going to happen is when this, when we get through this all, then we will look back and they will categorize the tests and actually figure out what tests actually work the best overall. But those are some of the hurdles that we're having because of how we rolled out the testing.
Yeah. So we have another testing question and then one after that, and then we can wrap up. Okay. So just to stay with testing, they just released today a test kit that we can buy for at-home testing. Mm-hmm. Can you speak about that? It is FDA approved.
Yes. So that is the test where I said you don't have to go as far back in your nose to actually get the swab. You can actually get the sample from a little bit closer in your nose. You kind of just have to, the test that was originally, you have to really, really jam it all the way back in your nose. It's very, very uncomfortable. The test that they actually did for home approval, you can just swab the front of your nose and actually send it in. As a much easier test to actually use for a lay person with no medical training to actually use. But again, we still do not have any sensitivity or specificity on these tests.
Okay, and we'll take this last question. Any likelihood this virus was created in a lab, especially given its virulence? I hope I'm saying that right. Virulence?
Yeah. Okay. Yeah. So the thing that we know for sure is that the lab that the virus has come from a bat, right? So the other coronaviruses, one came from a camel, one came from a bird. This one actually came from a bat. We do not know exactly where it came from because information hasn't really been forthcoming from China. So there are two theories. One is that it came from the wet markets. And the other one is that there was some concern around this virology lab that was in Wuhan. So the virology lab in Wuhan and the wet market are 1,000 miles apart. So I think what's going to eventually happen is they're going to actually trace this back to the bat or the group of bats, and they'll know where these bats came from and what part of Wuhan they came from. So we don't have the answer to that yet. It could have been either location. The patient 0, who was the first patient who they documented COVID-19 in, was a seafood vendor at the wet market. So that is why, but then other people have been saying they don't sell bats at that wet market. So that part hasn't actually been sorted out yet.
Okay. Well, we are right at 9 o'clock. So
All right.
I
All
want
right.
to thank you. And I want to remind people they can volunteer and that they can invite their friends to be a part of this. And they can do that via the email that was displayed or through Dr. V's website. Dr.
All
V,
right.
last words.
Thank you guys very much. And I feel like all of you all as a community, you guys are Dr. V because you all are getting as informed as we are, and spread the information, invite people to the webinar, and let's get people empowered around creating an action plan.
All right, thank you. I think that concludes what we're doing today, and we'll see you back here same time on Thursday.
All right, thanks.